Hello, this is Dr. Sandra Cabot, and this presentation is about menopause and hormonal imbalances. And I know that all women are interested in their sex hormones because they have such a profound effect on our mental and physical health. And yet, so many women have hormonal imbalances. So, in this presentation, you'll learn about the symptoms of the different hormonal imbalances, and you'll learn what you can do about menopause so you don't have to suffer. I mean, menopause is a natural change in our life, but it doesn't have to be an uncomfortable phase of our life. And because we live in such wonderful times, we have the natural bioidentical hormones that can help us to transition into and beyond the phase of our life we called menopause. So what does menopause mean? Well, it means the cessation of menstrual bleeding. So let's look at how sex hormones are made in our body. Well, sex hormones are made from cholesterol, and cholesterol is turned into a mother hormone called pregnenolone. And pregnenolone can be turned into many other hormones, and this happens in the ovaries. So in the ovaries, pregnenolone can be turned into progesterone, or in the adrenal glands, it can be turned into cortisol, which is an anti-inflammatory hormone. In the ovaries, it can also be turned into DHEA, which is this wonderful anti-aging hormone that we're going to learn about in this presentation. And DHEA can be turned into testosterone, the male hormone, which is also very important for women. And testosterone can be turned into the female hormone estradiol. So it really is a very complex biochemical process, if you like, that happens in our ovaries and our adrenal glands. But the interesting thing is, all these wonderful steroid hormones are made from cholesterol, which we get in our diet. And if we don't get enough cholesterol, our liver will make enough cholesterol for us to make these hormones, because cholesterol is essential for life. So what happens when you run out of estrogen is your body temperature can go haywire, so your body thermostat is not working properly, and some women do get a lot of hot flushes or flashes, and other women don't. And interestingly, if your liver is not working well, you can get much more severe hot flashes. So how do you know if you're menopausal? Well, there is a simple and inexpensive blood test that will tell you. What we do is we measure your FSH, which stands for follicle stimulating hormone. And if this is consistently elevated above 30, then you really are menopausal, and particularly if you have not had a menstrual period for a year. So why is the follicle stimulating hormone elevated? Well, what happens in menopause is basically your ovary goes on strike, or you could say it goes to sleep. You can see in this cute little cartoon, and that seems to upset the brain. So the brain tells the pituitary gland to send the follicle stimulating hormone through the bloodstream to the ovaries to try and stimulate them back to work. Unfortunately, that doesn't work, because the ovaries have run out of eggs. And if they have run out of eggs, they cannot produce sex hormones. But the pituitary gland doesn't seem to realise this, so for the rest of a woman's life after menopause, there will be very high levels of the follicle stimulating hormone in the blood, and we can measure this. And that is how we know if you have run out of ovarian eggs, and we know you are menopausal. So the pituitary gland will continue to do that So it's really wasting its energy, but we don't really know the reason for that. Mother Nature can be curious. So let's look at some of the blood tests that we do to see what type of hormonal imbalance you may have. And this is very, very important to match the level of the hormones in your blood with your symptoms, because we want an accurate diagnosis. Now, before menopause, we have a monthly menstrual cycle, and you can see that the level of estrogen depicted in blue, it really goes up and down a lot before and after ovulation. And the level of progesterone depicted in pink is really only significantly present after ovulation. Here we have ovulation. So after ovulation, the ovaries produce lots of progesterone, which is a wonderful hormone for our health. And unfortunately, a lot of women in this day and age do not produce enough progesterone. So from this fluctuation in estrogen and progesterone, you can see that measuring the level of estrogen and progesterone needs to be timed with your menstrual cycle, otherwise it's quite meaningless. For example, if we measured your estrogen here, it would be low, but that doesn't mean you're menopausal. What we need to determine is what your follicle stimulating hormone is, and if that is elevated and your estrogen is low, then we know, yes, you have arrived at menopause and your last good egg has gone to sleep. So let's look at some of the symptoms of hormonal imbalances. Now, if we're low in estrogen, we mentioned that you can get the hot flashes. You may not sleep well. Well, that's understandable if your body temperature's not working. You may have very low sex drive. You may have dryness and fragility of the vagina, so that sex becomes very uncomfortable. You may have bladder irritability, so you pee too often and you have urgency where you have to rush to the toilet to have a pee, which is most inconvenient. Now, if you've got too much estrogen, let's say you're taking too much estrogen, or your own body is producing too much estrogen, then you may have tender or lumpy breasts, you may get migraines, and a lot of women on the contraceptive pill will get bad migraines because they're taking synthetic high-dose estrogen, and this is very conducive to bad migraines. You may feel a bit depressed, you may have worsening of varicose veins, and you may have fluid retention. So that's the symptoms of estrogen excess. Now let's look at progesterone. If you are low in progesterone, you may have heavy menstrual bleeding or painful periods. You may have fibroids. You may have endometriosis, which is very painful, or adenomyosis, which is where you have lumps growing in the uterine muscle, which can be painful when you have a menstrual bleed. You may have unexplained infertility, polycystic ovarian syndrome, premenstrual syndrome where your moods really deteriorate before menstrual bleeding, and then when you do have a menstrual bleed, your mood changes for the better. So progesterone has a big effect on our brain and our mood. You may have postnatal depression, and this is why we use progesterone for women with severe postnatal depression, and it does not interfere with breastfeeding. It's perfectly safe, and I have a lot of podcasts on pregnancy and postnatal, which I actually made with my sister, who has had 3 children and believes in natural mothering, so they're quite interesting podcasts. You may have iron deficiency if you're low in progesterone because you've got heavy menstrual bleeding, and unless we overcome this progesterone deficiency, you will stay chronically exhausted from ongoing iron deficiency. You may have menstrual irregularity, you may have hair loss, you may have a worsening of autoimmune disease, you may have breast pain and lumpiness, and you may even notice an aggravation of premenstrual epilepsy if you suffer with epilepsy. The lack of progesterone premenstrually can cause more convulsions at that time. Now, if you have too much progesterone, you may feel sleepy, you may get a little bit constipated, or you may get some breakthrough bleeding. So you can see that the symptoms of progesterone deficiency are far more prevalent than the symptoms of too much progesterone, and indeed progesterone deficiency is very, very common, is often not recognised, and unfortunately not treated. Now let's look at testosterone. Now we all know that men produce lots of testosterone, but it's a very important hormone for women as well, and I see quite a few women who are testosterone deficient, and the symptoms of lack of testosterone can be non-existent libido, aches and pains, depression, fatigue. Very low testosterone can increase osteoporosis and cause muscle loss. So this is not good. And it's important to check your testosterone level with a blood test if you have these symptoms. Now, if you have too much testosterone, let's say you have polycystic ovaries, or you're taking too much testosterone from your treatment, then you could have hair loss, you could have too much libido, you could have unwanted weight gain, but that'll mainly be muscle gain, not fat. You could get acne and greasy skin, and you could get a deep, sexy voice when you don't want one. So you don't want to take too much testosterone. It's all about fine-tuning your hormones so that you are functioning at your best, at your optimum level, and hormones are very important for that. DHEA, that stands for dehydroepiandrosterone. So that's a hard thing to say, very long name, but DHEA is an important hormone. It's actually made predominantly in our adrenal glands, and as we get older we don't produce as much. When we're young we have lots of DHEA, and it really helps us to function at a high level. As we get older we produce much less DHEA, and this can cause fatigue and aches and pains. If we have too much DHEA, we can get symptoms similar to too much testosterone, because DHEA has a weak androgenic effect, or if you like, a similar effect to testosterone. And so DHEA is considered to be an anti-aging hormone, so we don't want to be too low in DHEA. So let's look at some of the blood levels of our sex hormones, and we can see after menopause the FSH will be high. It'll be above 35 and it will stay high, and as you get older it may go up to 100 or even 150, because your pituitary is pumping out very large amounts of follicle stimulating hormone to try and get your ovaries going again, which unfortunately is a waste of time. Now, when we measure your estrogen, if you're menopausal, it will be under 170, and in some cases it's actually too low to measure. So basically, you know, you really don't have any estrogen if it's too low to measure, but that's not uncommon. Progesterone after menopause will be very low, under 0.2. Testosterone in women, the normal range is 0.1 to 1.8. In men you can see it's much higher, and then we also measure the free testosterone, which in women is 1 to 34, in men much higher. And the free testosterone is the active hormone that's floating around your bloodstream, so that's far more effective than the total testosterone. And let's say your free testosterone is only about 2 or 3. Well, it's still in the normal range, isn't it? But it's not really optimal. If you have symptoms of progesterone deficiency, you would want to get your testosterone level up to about 10 to 15, and you may feel completely different. You know, you may find that your mood improves, your libido is much better, and your aches and pains are much less. So these blood tests are very accurate. I know some people have salivary tests for hormones, but they are far more expensive, and I don't find them as reliable as the blood tests. Adrenal glands are very important after menopause. These little adrenal glands which pump out your cortisol and your DHEA, and you really need strong adrenal glands throughout your whole lifespan, but particularly at menopause, because if you're running out of ovarian hormones, well, the adrenal glands will compensate to some degree. So we can measure your adrenal function. We measure your cortisol level in your blood in the morning, where it's meant to be higher than later in the day, and you can see the normal range is 138 to 650. Well, we'd like yours to be around 500, because the morning is the time when your adrenal glands need to be active, because they're pumping out the cortisol and the adrenaline to help you face the challenges of a new day. Later in the day and the evening, your cortisol levels go down a lot, because that helps you to chill out, wind down, get you ready for sleep. So we'd like your cortisol levels in the late afternoon to be around 200. So if your cortisol levels only around 138 or 70, that's not good, because that means you've got adrenal gland exhaustion, particularly if it is like that on several occasions. So that means we need to rejuvenate your adrenal glands so they produce more cortisol and DHEA, or we need to give you some DHEA. Adrenal glands are very, very important for your energy and your immune system. Now, natural progesterone is a really interesting hormone, and I have prescribed natural progesterone over the last 30 years to thousands of women to help them overcome all the problems that we discussed that can result from progesterone deficiency. So natural progesterone is bioidentical to your body's own progesterone. It's the hormone of fertility. It helps your immune system, and it helps your thyroid to work better. So if you have a thyroid problem and a progesterone problem, then you've got a double whammy. So we need to balance the progesterone and the thyroid to get you optimized. So progesterone can reduce many, many symptoms, and interestingly, progesterone helps you to be calm. It's a relaxing hormone. It helps you to be more peaceful. And often women who are low in progesterone have a lot of anxiety, particularly premenstrually. And progesterone can also help women to get over postnatal depression much quicker, and unfortunately this is often neglected to be prescribed in women with postnatal depression, and therefore they take much longer to get over it. So this is very, very sad, and it really needs to be brought to light. So how do we use progesterone cream? Well, we can rub it into the inner upper thighs, or we can rub it into the opening of the vagina, and we rub it in thoroughly at the same time every day. And if you're premenopausal, you stop the progesterone cream on the first day of your menstrual bleeding, and then you wait 10 days and start it again, You keep going with it until your next menstrual bleeding occurs, and you stop the cream on day 1 of the bleeding and then begin it again 10 days later. And this fits in with your own natural menstrual cycle. Note that natural progesterone will not work if you are on the contraceptive pill, because the hormones in the contraceptive pill will block the receptors from responding to the natural progesterone. Progesterone is not a contraceptive, by the way, and it does increase your fertility, so you'll have to use other forms of contraception. Now, menopause is a time that typically occurs between the ages of 45 and 55, and a lot of women think, well, they can only take hormone replacement therapy during that time and not for more than 5 years. That is not true. The bioidentical hormone replacement therapy is very safe, and I have patients who are still taking bioidentical hormones in their 70s and 80s because it helps their well-being so much, and it also helps their bone density. So if you are postmenopausal and no longer have menstrual bleeding, you can use the hormone replacement therapy cream or lozenges every day. You don't need to use it cyclically because you don't want a menstrual bleed. We don't want to obviously have menstrual bleeding when we're in our 60s and 70s or 80s, and indeed we don't usually get any bleeding at all on the bioidentical hormones in older women because we use such low doses of the hormones. You can take hormone replacement therapy in many different ways. Generally speaking, hormone tablets have fallen out of favour because they go through the liver and they can increase the risk of blood clots, particularly if you're using high doses. Hormone injections generally have fallen out of favour too because they're very strong. Implants, some women have hormone implants. I personally don't use them because I find even though they're delayed release and you get like a general level persisting for months, I find that when they are first put in, the level spikes, and then as they wear off, the level goes down to low. So I generally don't use hormone implants, but some doctors do, and some women find them very good. Vaginal estrogen can be used as a cream. It is very, very good for women who have vaginal dryness or vaginal atrophy, want to improve their sex life, want to improve their bladder function. It can be rubbed into the opening of the vagina, or it can be inserted high into the vagina with an applicator. We can use transdermal, that means through the skin, and we just rub it into the skin of the inner upper thigh or the opening of the vagina. We can use patches of estrogen, and some of these patches also contain progesterone, although it's not natural progesterone, so I don't use synthetic progesterone because it has a very different effect in our body to natural bioidentical progesterone, and not nearly as good as the natural bioidentical progesterone. Some women use lozenges, which are known as troches, and they're depicted here. And the theory for the troches is that they're not absorbed through the gut and therefore don't go through the liver. Perhaps that's not 100% true, so I don't tend to use them as much, but some women do prefer troches, and as long as we're not using excessive doses of estrogen, I think they're quite safe. nasal sprays I don't really think are suitable. So there are many ways that you can get the hormones into your body, into where they really work very well. But my preferred way is to use estrogen creams and progesterone creams or progesterone capsules. Now, the doses that you'll need will vary a lot depending on your symptoms and your age, and are easily adjusted depending on your blood tests and the alleviation of your symptoms. Now, let's look a bit more closely at estrogen and the types of estrogen. In your body, there are 3 types of estrogen. There's estrone, which is made in your fat. There's estradiol, which is made in your ovaries. And there's estriol, which is made by the placenta. So all these estrogens are made in your body, so if we give them to you as a hormone replacement, we try to match the exact shape of these hormones bioidentical, so they're exactly the same as your body's own hormones. Now, the most commonly prescribed form of bioidentical estrogen is Biest, and this contains estradiol and estriol, generally 20% estradiol and 80% estriol, and this is very safe. And it's interesting that we're using estriol, which in our body is made in the placenta, but we do use it because it's safe, and that's because it's water soluble, so it's very easy for your liver to break down. It will not accumulate in your body. The estradiol is bioidentical, and that is also safe and particularly good used transdermally through a cream or a patch. Now, you can still produce quite a bit of estrogen after menopause in your fat, particularly if you're overweight. And when you lose weight, get into the healthy weight range, your estrone may come down, which is good, because we don't want too much estrone, because we know that, being overweight increases your risk of breast cancer. So as I said before, a lot of older women do take hormone replacement therapy because it slows down aging. There's no doubt about that. It makes us feel younger, and it's definitely very good for our skin. It reduces wrinkles, and a lot of women will stay on it for years and years and years in a low dose, so they can slow down the aging process. The only contraindication to estrogen and progesterone therapy is if you have had breast cancer, because this could possibly increase the risk of it coming back. We really don't know. We don't have the long-term studies, but there are other natural things that you can do if you have had breast cancer. Now, a lot of women are confused about the safety of hormone replacement therapy because of the Women's Health Initiative study, which was done a long time ago and used synthetic hormones and hormones that came from horses' urine in high doses, and also looked at much older women, and so the results weren't good, and they showed that there was a slight increase in breast cancer in women who took this synthetic form of hormone replacement therapy. So a lot of women had trouble getting any hormone help after that study was published. But we know that bioidentical hormone replacement therapy has been shown to be much safer than synthetic HRT or animal-derived estrogens. And there's a very good study by a Dr. Ken Holtorf, published in a postgraduate medicine journal in 2009, which was a big meta-analysis, and it showed that bioidentical hormone replacement therapy is the safest form of hormone replacement therapy. So you can check that out for yourself if you want. Now, the Women's Health Initiative study was halted in 2022 because it showed a suspected link between HRT and breast cancer. As I said before, the study was flawed because it looked at older women who have a higher risk of cancer anyway. It looked at estrogen that came from horses, and it looked at synthetic progesterone and not the natural progesterone. So it was a flawed study, and when it was reanalysed, it showed the link between cancer and HRT was not really significant. So a lot of women are confused because of that study, but the other study I mentioned by Dr. Ken Holtorf shows that bioidentical hormone replacement therapy is safe. So don't be put off, if you're really suffering from lack of sex hormones in your life at menopause and postmenopausally, then you really can try hormone replacement therapy. Try it for 3 or 4 months. You can be your own test case or your own clinical study, and you may notice a dramatic improvement, or you may not. A lot of things in medicine are trial and error, and it's worth trying because you should notice a big improvement within 1 month. It doesn't take a long time to work. Your cells have receptors for hormones, and the receptors will pick up the hormones, and these hormone messages will influence the metabolic activity in every cell in your body, including your brain. So if you're suffering, go and get help. Go and see your doctor. Talk about bioidentical HRT, or email us and we'll be able to guide you in the right direction. Now, with the bioidentical hormones, where do they come from? Well, they actually come from plants, particularly yam plants, and these are turned into human hormones, which are identical to the hormones your ovaries used to produce. That's why we call them bioidentical. Now, HRT and breast cancer risk. Well, another study in 2019 in women aged 50 to 69 found that breast cancer risk increased from 6 to 8% if you take HRT, which is a very small increase, and once again it really didn't take into account the dose of hormones, and often you only need very low doses which will not have any significant risk increase in breast cancer. And if you look at all the other things that increase your breast cancer risk, they really are far more significant than a low dose of HRT. For example, too much alcohol. If you're overweight, remember you'll produce too much of that estrone hormone from your fat. If you have a high sugar diet, if you smoke, if you don't exercise, or if you're deficient in these essential nutrients, vitamin D, selenium and iodine, which protect your breast tissue. These are far more significant risk factors for breast cancer than bioidentical hormone replacement. So we've got to put everything into perspective, and then we can relax and we can get the proper help. And menopause can be a very stressful time. Here you are going through the change of life. You may be dealing with elderly parents, you may have teenagers, you may still be working. Your hormones are disrupting your sleep and making you moody. Brain fog is a common symptom at menopause. So a lot of women really don't cope very well, and you can't blame them. They could have a nervous breakdown, and it's not necessary. You really need to realise that you need to take time for yourself here. You've got to look after your health, you've got to exercise, you've got to try and eat correctly, and get enough sleep. Very, very important. And the bioidentical hormones can really make a big difference to your ability to cope with stress. And so can things like magnesium. Magnesium is a wonderful mineral to help you get through menopause. I call magnesium the great relaxer. It'll relax your mind, your nervous system, your muscles, help you sleep. And if you have a lot of stress, you'll use up magnesium much more rapidly in your body. So remember, magnesium, you need about 400 milligrams a day. It can really change your life. Now, in the good old days, menopause was tough because women really didn't get much help. Just imagine how it was 100 years ago when women had so many children. And this is a little cartoon of a poor lady going through menopause who's rapidly approaching the change of life when she can look forward to hot flashes, crazy mood swings and chalky bones. Well, it doesn't have to be that way anymore, girls. It used to be that men could look forward to sporty convertibles, gold chains and young girlfriends. But often women these days, if they're financially independent, they can look forward to the sporty car and continuing to work and taking their hormones to have a great libido. Maybe they can have a younger boyfriend. Now let's look at phytoestrogens, which are the estrogens that come from plants. And so not all women want to take prescribed hormone replacement therapy because, you know, they may have had breast cancer or they may have a strong family history of breast cancer, and they may want to try natural plant hormones before they get a prescription from a doctor for bioidentical hormones. So phytoestrogens come from different plants and herbs, and they have a similar structure to human estradiol. So here's the human estradiol structure, and over here is the structure of the estrogens that we find in different plants and herbs. And you can see that the cell receptors here, they will accept the plant hormones just as they will accept the estrogen that comes from our ovaries or from a prescription. So the plant hormones actually fit the receptors on the cells and have a similar effect in our body. So we can find these plant hormones in various fruits, vegetables, beans, especially soya beans, yams, licorice, sprouts, cabbage, hops, garlic and onion. So a lot of women do eat more of these herbs and foods to help them. Flaxseed, which is known as linseed, is also a good source of plant estrogens. And studies have shown that phytoestrogens in our diet or as supplements have a beneficial role in reducing the risk of cancer. And they correlate with a decreased rate of hormone-dependent cancer development, including cancer of the uterus and the breast. And they also have a positive effect on bone density and heart health. So it's good to eat these plant hormones. You can also take a supplement of plant hormones, and this is one that I've formulated. There's many other good ones on the market, but this is one that I've formulated that contains a mixture of phytoestrogens from herbs, and these phytoestrogens can reduce the symptoms of low estrogen and low progesterone. So the FemPhase contains a selection of phytoestrogens, and it also contains your vitamin D, vitamin K, vitamin E and C, bioflavonoids, B vitamins for stress, and calcium for your bones. And it also contains organic iodine to help your thyroid gland. So you need a healthy thyroid gland going through menopause, that's for sure, because you need energy. And the thyroid gland controls your metabolic rate. So FemPhase can be a very useful natural hormone balancer for you pre-menopause, during menopause and post-menopause. So the phytoestrogens in the FemPhase come from wild yam, soy, linseed, licorice, chasteberry and Don Quai, and these things have been used for thousands of years to help women transition through menopause, and you can take these things for many, many years. They're very, very safe, and as we said, they reduce your risk of hormone-dependent cancers. We also have horsetail, which is a herb in the FemPhase to give you silica, because a lot of women have hair loss during menopause, and this silica can really help to strengthen your hair and nails. So FemPhase can be used as a natural alternative to hormone replacement therapy, or as an addition to hormone replacement therapy to support your sex hormone levels during times when your hormones are rapidly changing. It can also help your libido and your skin and poor sleep. Now, you know, a lot of women find that when they go through menopause, they put on weight. Very frustrating, as if you haven't got enough symptoms already. Now, it's very important to have good muscle mass to avoid weight gain, and also to keep your bones strong and to avoid falling over. So you've got to maintain the muscle mass to keep your metabolic rate high. So you need a good exercise program. You know, regular exercise, 30 minutes a day is fantastic. Walking, swimming, Pilates, yoga. Build up your muscle mass, and you'll find it much easier to avoid weight gain. Also, eat more protein and healthy fats and reduce the carbohydrates. Quit sugar, except you can eat fruit, of course, that's healthy sugar. And quit processed food, which is often high in sugar, and unhealthy plant oils, which are processed oils, what we call omega-6 processed vegetable oils. Avoid those because they will cause weight gain. And eat natural unprocessed food, plenty of protein, you know, like red meat, chicken, eggs, nuts, seeds, some good quality cheese, and avocado, olive oil, coconut, all those healthy fats. They don't cause weight gain. What causes weight gain at menopause is too much carbohydrate from processed foods and refined sugars. So keep your muscle mass up and weight gain is much less of a problem. Now, I've written quite a lot of books on hormonal problems for women. One called Don't Let Your Hormones Ruin Your Life, and that covers all the different possible hormonal conditions of women, like polycystic ovaries and pituitary problems and postnatal depression. I've also written one on menopause. I've written one on improving your sex drive with bioidentical hormones. And I've written one called How Not to Kill Your Husband. And why I wrote that book is because a patient came to see me one day, and she sat down in front of me and said, Dr. Cabot, I really need your help. And she looked very unhappy. She was about 45. She was overweight, looked very stressed. I said, okay, well, tell me, what's your problem? And she said, Dr. Cabot, I am sick of lying in bed at night and thinking of 25 ways I can kill my husband. And I thought she was joking. But no, she was deadly serious. And so when we looked into her case, she had a severe hormonal imbalance. She had polycystic ovaries that she had got later in life after having children. And this causes insulin resistance, which means she was carbohydrate intolerant and had put on a lot of weight from the insulin resistance. She hadn't had a menstrual bleed for 5 years, but she was not menopausal. Her FSH level was low, but her testosterone level was very, very high, almost as high as a man's. Her progesterone level was non-existent. So this poor lady, she hadn't been ovulating because of the polycystic ovarian syndrome, and so she had hormones really almost like a man and no progesterone, so she was very aggressive. And this was all hormonal. So I said to her, what you really need is natural progesterone. So I gave her natural progesterone and I put her on a low carbohydrate diet. I gave her magnesium to help her relax. And after 3 months she came back to see me and she had had a menstrual bleed. And she said, I feel completely different. I no longer want to kill my husband. She was dramatically different in her mood. She looked so much more relaxed. So, hormones are responsible for a lot of relationship difficulties. And if you have a woman with too much testosterone and not enough progesterone, they can be very aggressive. If you have a woman with very low testosterone and not enough estrogen and progesterone, they can have no libido. So this can really destroy marriages. So it's very important that women get their hormones tested and receive appropriate treatment. I've seen so many women who have suffered over the years because doctors don't understand that women's hormones have a huge effect on their state of mind, and they don't test them enough, and therefore they don't get the appropriate treatment. So I hope you have enjoyed listening to this video, and I advise you to get help if you're suffering, and also if you have any questions, email us at info@Cabot Health. And if you like this video, click like and subscribe, and thank you for listening.